Bites and stings. So, different insects, different creatures bite us. Arthropods could be insects, spiders, or scorpions. Reptiles, such as pit vipers, which are basically rattlesnakes and coral snakes. And venomous marine life. So, generally, bites and sting deaths, 50% come from insects, 30% from snakes, 14% from spiders, and 6% from all others, including marine life. Hymenoptera stings. These are some real common ones that people know about. So bees, wasps, hornets, yellow jackets, and ants. About 25 deaths per year. Honeybees, 50%. Yellow jackets, other wasps, 50%. They've started having more and more problems locally with the, what are they, the African killer bees or whatever. We have a few attacks a year where people get stung 200 plus times. Usually it makes the news when it happens. Usually it's some sort of construction type work, either on a house or clearing brush or something, and they run into a nest. The big problem with these are people are severely allergic to them, so they go into anaphylaxis, and they have toxic venom. So toxic venom effects are rare. It's not necessarily the venom in them, but it's the systemic reaction that it causes in the body that causes problem. Everybody will have a localized reaction. If you get stung with a bee, you'll have the sharp burning pain, itching. You may get some swelling at the site. Extensive reactions may involve entire extremity. Tongue, throat stings may cause airway loss. And that's kind of what we're more concerned about with these type of reactions, is their airway. So you can have different levels of systemic reaction. A mild reaction, you may have diffuse itching. You'll have urticaria, which is like hives showing up on the skin, swelling distant from the sting site, and flushing of the skin. So if you have swelling anywhere besides the local area where you were stung, then you know you're having some level of systemic reaction. Severe systemic reaction causes laryngeal edema, upper airway obstruction, which can lead to death, severe bronchospasm, difficulty breathing, and profound hypotension, which can also be life-threatening. This is anaphylactic shock. Okay, if it causes, a severe systemic reaction, causes airway compromise or hypotension, you're in anaphylaxis. Other cause of anaphylaxis could be medications, food, or plants. So people are allergic to peanuts, that type of thing. What do you do to manage anaphylaxis? You want to remove whatever they're allergic to. So if there's a stinger, you want to scrape it away. You want to scrape it with like a debit card or something. You don't want to grab it with tweezers, because the stinger a lot of times still has venom in it, and when you squeeze it, you inject more into the patient. So scrape it away. Manage their airway. That's usually the most important. Maintain oxygen to 94%. Assist ventilations as needed. Shock position. Administer epinephrine if you have it available, and call for ALS. Especially if you think there's any sort of airway compromise, get ALS there as soon as you can. Because if you can't reverse this process with the epi, then we're going to have to do some stuff to try to secure the airway pretty rapidly. Epinephrine, what's its action? It dilates the airways, so it's a bronchodilator. It also constricts the blood vessels, so it's a vasoconstrictor, and because it vasoconstricts, it raises the peripheral resistance, or basically it increases people's blood pressure. It also increases their heart rate. So why do we give epi to someone who's in anaphylaxis? Well, because they have bronchospasm, which we can help with because it's a bronchodilator, and the hypotension is caused by vasodilation, and epi is a vasoconstrictor. So you can see how epi directly counters anaphylaxis. What is it that's being released in the body that causes anaphylaxis? Does anybody know? Histamine. Yeah, what is histamine? Anybody? it's a hormone naturally occurring in the body, and when it's released, when histamine gets released, it tells the body basically to fight. And what it triggers is, because of this toxin that's been injected to the body, it causes a histamine response that, instead of doing a precision drone strike, the body invades Iraq. Okay? And you have a way too big reaction. And that's what causes anaphylaxis. There's way too much going on for what it is. I mean, it's just a little bee sting. That's not supposed to kill anybody, right? It should just hurt a little bit and then go away. Well, no. These people have a extreme response. It doesn't happen the first time they're stung, but the second and any adjacent times after that, they've built up this response to it, and that's what kills them, is the bronchospasm and the severe hypotension from the vasodilation. And that's because the histamine is a vasodilator, and it causes all the swelling. Okay? Covered that. So this is what an EpiPen generally looks like. You pull off the black cap, there's a needle, you stick it in their leg, hold it for 10 seconds. Okay? When do we give Epi? We give it for an allergic reaction with respiratory compromise, so rapid labor breathing, chest, throat tightness, hoarseness, stridor, or wheezing. Any of the signs and symptoms of respiratory compromise with the history of allergic reaction or that type of mechanism of injury, you want to give the EpiPen earlier rather than later. If you wait too long, you're going to be behind and it's not going to work. You don't wait till they're in shock. You give it when they're showing the earlier signs and symptoms of the respiratory compromise. Hypoperfusion, rapid, weak pulse, altered level of consciousness, or decreased blood pressure, you need to give the Epi Auto-Pen. Remember, these are pretty much all late signs of shock. If they're already altered and they already have a decreased blood pressure, they're well into anaphylactic shock. Okay? You want to give it to them when you see the early signs of shock and see what's occurring. Contraindications for Epi, none for severe allergic reaction. Use with caution if they are older or have significant cardiac history. But again, none in severe allergic reaction. Okay. Adult, what's the dose? 0.3 milligrams. Pediatric, 0.15 or 0.15 milligrams is how we say it. Okay. So pediatric dose is half the adult dose. Procedure, expose clean side if possible, remove the safety cap, inject at a 90-degree angle to the skin, lateral thigh midway between waist and knee, push against thigh, hold until medication injected, which takes about 10 seconds. Okay? Is this going to hurt? A little bit. Okay. Side effects of epinephrine, again, it's going to increase their heart rate. It may cause their skin to go pale, may cause a headache, can even cause chest pain, or they may feel some palpitations in their chest as their heart rate increases. It can cause nausea and vomiting and anxiety. Remember all those early signs of shock kind of that we've talked about, the anxiety, all that type of stuff. I mean, that's because the body's releasing epinephrine. Well, if you inject epinephrine in them, they're also going to show some of those signs and symptoms, right?
Wouldn't they have pale skin before you put the epinephrine?
If they're going into shock, yeah. Well, when it's an allergic reaction, they get flushed skin because they're vasodilating. So they actually turn really red. And they start getting the hives and the rashes and everything on them because they're vasodilating. So if you give the epinephrine and it's actually working, it should make their skin go back more towards normal or even make them pale. But it largely depends on how early you give it to them. And honestly, most of the time I've given epinephrine, they've already been hypotensive. And so when you give the epi, I mean, you're lucky if it gets the blood pressure up type of thing. Yeah. Precautions, give oxygen first, monitor vital signs following use. Again, there's no contraindication in severe allergic reaction. So assess your patient, do a good assessment, and once you know it's an allergic reaction and they're showing those signs of respiratory distress or hypotension, then inject the epi. Get on it. Spiders. There's spiders everywhere. Okay, 37,000 species of spiders. All of them are venomous. 50 U.S. species can bite humans. So only 50 spiders can actually bite you. 15 U.S. species produce symptoms. Only 2 are dangerous, the black widow and the brown recluse. Okay? Those are the 2 that we have to watch for. So black widow, as far north as Oregon, New York, common in southwest. So yay, we have those here. Irregular webs in wood piles, trash dumps, outdoor structures, under rocks. Occasionally they can be found in houses. Females rarely leave the web, and only females will bite humans. You know it's a black widow because it's got this nifty one. They have a real black body, but they have this nifty hourglass-shaped red mark on them. Yeah, they're here. Neurotoxic. So neurotoxic meaning it's going to cause neuro symptoms if they bite you. Immediate sharp stinging pain, muscle cramps in 15 minutes to 2 hours, upper extremity pleuritic chest pain, lower extremity genitalia, abdominal pain, rigidity, depending on where you've been bit. Okay. Muscle twitching, weakness, paralysis, and drooping eyelids. Sweating, tearing, salivation, increased bronchial secretions, anxiety, headache, restlessness, dizziness, nausea, vomiting, hypertension, edema, skin rash, conjunctivitis, itching, shock, and respiratory depression. Again, it's a neurotoxin. So what is it going to affect? It's going to affect the nervous system, both the autonomic and the regular nervous system. And it's literally going to put you into muscle paralysis and cause you to suffocate. Symptoms peak in a few hours, diminish, usually last less than 24 hours, some symptomatic up to 4 days. Mortality rate is unknown, most recover completely. You don't, the reason they say mortality rate unknown is they don't believe that a lot of spider bites get reported. So while they may know the few cases that show up to the hospital and are really sick and may die, they think the vast majority of people who are bit by a black widow never even know it. Okay? They might get bit, they might feel like they have the flu for a day or two, their body fights it off, and then they're fine. And so it doesn't get reported, so they're not sure what mortality would be. Black widow treatment, local cold application, symptomatic care. So again, not everybody's going to have all the symptoms, so you're going to provide symptomatic care for whatever symptoms they do. If you have identified the spider and you transport it to the hospital, there is anti-venom that the patient can receive. Brown recluse, also known as the fiddleback spider because of the shape. Southeast, south central United States. Related species in desert southwest. Shy and nocturnal. Likes dark closets, basements, on floors, behind furniture in houses. Just looks like a brown spider. Local signs, symptoms, no pain or only mild stinging when you get bit. Within 2 hours, local pain and a blue-gray halo. See the little color change here, kind of at the top of that bite? Blue-gray halo, 12 to 18 hours, blood formation, growing ischemic zone. So you can see kind of the ischemic zone going around this guy's. Looks like that's his ankle. 5 to 7 days, aseptic necrosis, necrotic ulcer. Severe lesions up to 30 centimeters in diameter. Systemic signs, symptoms, mild, you might get fever, chills, malaise, nausea, vomiting, and joint pain. Severe, you can have bleeding disorders, renal failure, convulsions, heart failure, and death. Fatigue. It's what you were last Saturday. That was malaise. Okay, pre-hospital management, local cold application, wound cleansing, padded splint, bulky dressing. Okay, so ice pack. Wound cleansing, warm soapy water initially, but that nasty of a wound at the hospital, they may cut out some of that tissue, that type of stuff later on. Scorpions, we also have those here. 40 U.S. species, only one potentially lethal. primarily in Arizona, occasionally in western New Mexico, southwest California, northern Mexico, or far west Texas. Local signs, symptoms, no local swelling or inflammation, just pain, hypersensitivity to the area. Occasionally, again, some people may have a bad reaction to them. For most people, it's 15 minutes of localized pain and then they feel better. Systemic signs, symptoms, extreme restlessness or agitation, roving eye movements, poor coordination, slurred speech or difficulty swallowing, salivation, wheezing, stridor, tachycardia, tachypnea, hypertension, nausea, and vomiting. So if this guy is the one that actually stings you, then you're going to look for those same kind of poisoning symptoms. You guys notice we talk about salivation in almost all of these. When people are poisoned, that's one of the things that the body does, is it causes them to salivate. Okay. Treatment, symptomatic, non-specific treatment, anti-venom available from Arizona State University, which is, again, the scorpions normally found in Arizona. So if needed, they can either fly the patient there or fly the anti-venom out. Again, that's going to be difficult to identify without capture of that scorpion. But don't get stung yourself. Don't go crawling around in dark places looking for it. Okay. If they, yeah, that won't matter. As long as they can get kind of identify it. Snakes, I hate snakes. Okay, 45,000 bites per year in the United States. 8,000 of those bites are from venomous snakes, and it leads to 10 deaths. So only 10 people a year die. Yay. Okay. Pit vipers, such as rattlesnakes, copperheads, and water moccasins, and then coral snakes. Those are your 4 dangerous snakes in the United States. So pit vipers, they have heavy bodies, diamond-shaped heads, vertical elliptical pupil, so it's slit that way, up and down, vertical. Heat-sensing pit on upper lip between eye and the nostril. They have erectile fangs, which means they aren't always up, but they can move them up. And they are hemotoxic, necrotoxic venom. So hemo mean blood. So rattlesnakes, 13 species, 7,000 bites per year. So again, we said, what was it, 8,000 bites? Well, 7,000 of those are from rattlesnakes. Okay, 9 to 10 fatalities. Oh, look, almost all of the fatalities come from rattlesnakes. Most deaths from western diamondback or eastern diamondback, which that's a diamondback rattler. Yay. Copperhead, deaths very rare, minimal edema or pain. Water moccasin, average of 1 death a year. They're kind of shiny black, and they have a white ball in their mouth. They open up their mouth and kind of hiss. They have a white cotton ball looking thing in their mouth. That's why they're also called cotton mouths. Mild systemic symptoms, potential for severe local tissue injury and necrosis if they get you. So pain, swelling, progressive edema, bruising, blood-filled vesicles. So literally, if you get bit by one of these guys, the hemotoxic effect, it's going to cause a ton of swelling. You can see this guy, you can barely tell the fingers apart. Like it's an intense amount of swelling. It can spread very, very quickly. Weakness, sweating, nausea, vomiting, tachycardia, hypotension, and shock. That's what you really want to watch for in these guys. If there's enough swelling, they can throw themselves into shock. It prolongs their clotting. They may start bleeding from their gums. They may have bloody vomit, blood in their stool, or blood in their urine. Numbness, tingling, neurological symptoms. So as that hemotoxic venom spreads through the body, it can cause internal bleeding as well as the area where you see the local swelling, which is why they can be potentially deadly. Talking about pit vipers, they don't always cause poisonous bites. Okay, so a rattlesnake, he can decide to inject his venom or do what we call a dry bite, where he just bites you. Okay, they don't always have to inject you with the venom. However, the baby snakes, the small ones, like the last snake bite I ran was on like a 12-inch rattlesnake, okay, which they actually caught the rattlesnake and had it for us. It was very fun.
Did you take that with you to the hospital?
No, hospital doesn't want a snake. We took a picture of it. Anyway, the babies don't control their venom as well. So you're more likely to get a poisonous bite from a smaller snake than from a larger snake, because the larger snake knows you're not food, which is what they generally use their poison for. However, that being said, any of them can poison you. Okay, coral snakes, thin-bodied, small, rounded head, brightly colored, small, non-erectile fangs, which means they're out all the time, and injects venom by chewing, venom mostly neurotoxic. Okay, they've got to chew on you for a long time to get their venom really into you. Okay, but they bite so small if you're out camping or whatever, they get you when you're sleeping, they chew on your finger or whatever. Remember, red on yellow, kill a fellow, red on black, venom lack. There's another snake that looks exactly like them, but the color pattern is different. But either way, if I get chewed on by a snake that's black, red, and yellow, I'm taking myself to the hospital. Venom mostly neurotoxic, so again, it's going to have neuro effects. So little, no pain or swelling, tingling around the bite, muscular incoordination sets in, weakness, again, increased salivation, difficulty swallowing, talking, visual disturbances, respiratory distress failure, and shock. Most deaths occur from respiratory arrest within 36 hours. Okay. Snakebite management. Calm the victim. Because if I get bit by a snake, I'm going to be freaking out. Oxygen. Proximal constricting band. This is controversial. Okay. I will tell you, in our protocols for Williamson County, we do not do constricting bands. However, that used to be what was standard. So we don't generally do that. Clean bandage wound, immobilized bitten area, keep dependent. Watch constricting bands, bandages, splints carefully for edema. Remove rings, jewelry, that type of thing from the hands, and provide transport. Notice they don't say anything in here about placing an ice pack on the patient. Okay, they've kind of gone away from doing anything that would restrict or localize the venom into one area because it causes more damage. And they've found that they have better patient outcome by just kind of splinting the wound, keeping their heart rate down, and getting them to a facility that carries anti-venom, which they all carry anti-venom. Not all facility, all of these bites they have anti-venom for. So you may call ahead to the hospital, see if they have anti-venom for it. Generally, your trauma centers will have it. However, just because they have it doesn't mean that they'll have enough. They may have to fly in more depending on what happens. Do not apply ice. Do not apply arterial tourniquets. So a constricting band is just for venous flow only, not arterial flow. So just put it on, not too loose, but not too tight. Do not cut and suck. Does anybody remember the whole, you make an X and in between the vein marks and suck away? Okay. Do not use electrical shock. Don't ask me who thought that was a good idea. Okay. Actively attempt to locate the snake. That's not necessary. And do not bring the live venomous snake to a hospital. Okay. Also not a good idea. Which means that someone probably did. Okay. Venomous marine life. So jellyfish, Portuguese man of war. Stinging cells are in the tentacles, intense burning pain, red hemorrhagic lesions, looks basically like an abrasion, nausea, vomiting, fever, chills, dyspnea, wheezing, stridor, hypotension, shock, cardiovascular collapse. Same as with just about anything else. You're going to watch for respiratory symptoms and signs and symptoms of shock. If they don't have a systemic reaction, it's just going to be red, irritated, localized pain, and after a little bit, it'll go away. For these type of stings, jellyfish stings, kill stinging cells with alcohol or vinegar.
Is it true that you can pee on somebody? No, I'm not trying to be funny. But that you can pee on somebody that has a jellyfish sting
I've heard that. I've heard that it's true.
So,
So I'm not going to
yeah, vinegar might be better, but basically, in theory, is if you look at this, both alcohol and vinegar, they're kind of out there on the pH scales, and that's what kills the stings. The pH is pretty poor as well, and so it allegedly will also work. I just think of the Friends episode. So, stingray, scorpionfish, immerse stung area in hot water. Okay. By the way, these are all test questions. What do you do for a jellyfish sting? What do you do for a stingray sting? Okay, hot water. Sea urchins, again, hot water. Use vinegar to dissolve embedded spines. Larger spines may require surgical removal. Yay. Okay, questions about bites and stings. Most commonly, things that you're going to see around here are bee stings and snake bites. Because we don't have an ocean. So we're not going to see a lot of marine stuff, right? Any questions about how to handle a snake bite or a bee sting? So we talked about Epi for bee stings, right? If your patient's having stridor and wheezing, what's another medication you could give besides oxygen? Albuterol. There you go.